Hi, everyone, and welcome to this week's Ask a Navigator. Tonight, I'm excited because we get to talk about one of my favorite things, math. But before we get into that, let's talk about some things that are going on at Southwest Center and the greater Phoenix community. Ignite Your Pride, which is our outreach branch of Southwest Center, is going to have pop-up tables across the community. These are unmanned, unstaffed, gender, tables that are at different bars like Industry, Boycott, BS West, what have you, that will have condoms, tchotchkes, and information for you to grab and take away if you happen to go out to the bars. In addition to that, we have Healthy Relationships this month. So if you're interested in earning a $50 gift card and want to learn more about having healthy, constructive relationships in your life, please reach out to the Education Empowerment Team. And I believe you can find them at jquintero@swhiv.org. Or if you're having trouble reaching that, you can email me, Ian, at ecashman@swhiv.org, and I'll forward it to the Education Empowerment Team. Oh, thank you, Jericho. He makes everything easier. Speaking of Jericho, thank you, Jericho, in the back, who makes this production lovely every week. The show could not happen without him. In addition to Healthy Relationships, we have 3 chats this month. The first one is going to be the queer chat group, which happens from 6 to 7 p.m. on Monday the 16th. At that same time, because of month scheduling, there's also going to be the trans chat group that happens on the 16th as well. Later in the month, we have the Positive Living chat group, which is for HIV positive persons. So the queer chat group is for everyone who's part of the LGBT community. The trans chat group is for anybody who is trans and or non-binary questioning. And then the Positive Living is for HIV positive persons. I think that's everything I have. Let's bring on my co-host, who all of you love more than me, Mars.
I still do not know what to do when you say that every time.
They do. They love you more than me.
Oh, goodness. Okay, so I want to talk a little bit about testing and what we have going on with that right now. We are still doing teletesting. If you would like to get HIV tests sent to your house and to have a meeting with one of our testers virtually, please email testing@swhiv.org. And thank you so much, Jericho, for throwing that up there. We are also doing drive-through HIV testing Tuesdays and Thursdays from 10 a.m. to 3:30 p.m. Yes, I am looking at notes because that's the only way I remember all of our services. And then hopefully all y'all know by now that we have Nice Package. So if you need condoms mailed to your house, it is free condoms, free delivery. Nicepackage.org is where you go to get those ordered. And I help head that and we'll get you condoms sent to your house as long as you're in Arizona or Southern Nevada. We have a very limited space for this, unfortunately.
Do you have condoms for all parts and all genders?
Oh my goodness. I have 17 types of condoms and it makes me so happy. So we have FC2s. So basically we have insertables, we have externals, we have condoms with studs or patterns, we have extra larges. We actually have a variety of extra larges. I don't get animated talking about condoms, not at all. I didn't just suddenly go to like 3 times the speed. Hi, I really enjoy my job.
And we love you, Mars. That's why you're part of our team. So if you had any questions about any of those services, we have Jericho is just on top of it tonight. He's posted them all in the chat. You can check all these out on swcenter.org. You can also look at the Ignite Your Pride Facebook page. We have a calendar we release every month that lists all of these things. Tonight, though, we're here for Ask a Navigator. And I know I said math at the beginning, but please do not be afraid. Before we begin any Ask a Navigator, I have to give this disclaimer, though. I am not a doctor, nor am I a lawyer, so this is not medical or legal advice. But for the first time on Ask a Navigator, we do have a doctor. Please welcome Deanna Lewis.
Good evening, everyone. Thanks, Ian, so much for the introduction. I wasn't expecting that, a doctor. I'm like, wait, where like, whoa. I forget. So good evening, everyone. My name is Deanna Lewis, and I am a doctor. I'm a doctor of public health. I work at the University of Arizona, and I work with students, do a little bit of research, mostly try to figure out how to solve really complex problems. And when it comes to population health, the population that I'm most interested in and have always been interested in is working with marginalized and stigmatized populations. And I'm also a clinician. I'm a physician assistant. I've been a PA for 16 years. And one of the things that I've come to recognize is the lack of training and education that I received, the lack of training and education that public health students receive, the lack of training and education that medical students, pharmacy students, nursing students, allied health, on and on and on and on, lack in providing excellent care, right? Quality care to the LGBTQ plus populations, and the emphasis on sexual and gender minorities, transgender, non-binary, questioning. And so I've had the privilege of working with Ian and get to join you this evening. So thanks so much.
We're happy to have you. I met Deanna at a phlebotomy workshop where Z was teaching the whole class how to draw blood, for those who don't know what phlebotomy is. We started out on bananas, but throughout the class, she was saying why this skill was so important, and she always contextualized it in forms of, you are there to serve communities who need your help. Like, it's important that you all have this skill. And in every project we work on, the front and center goes, care about the people you are working with, and this is how you do it. Z also taught me one of my favorite phrases now: nothing about us without us. You exude us excellence in all you do. And I'm so happy you're a part of our community and you agreed to come on the show.
Thank you.
So let's see if we have any questions to start. Oh, the topic. I should probably do that. Tonight, we're talking about missing statistics. So in that, it seemed like a fun name, but it's a little bit more than just stats. We're talking about how trans and non-binary folk are largely absent from a lot of the public health data we have, and really a lot of the data we have in general, and what this means for our world. So what it means for schools, for healthcare, for education. We're probably going to focus more on health because that's where Southwest Center's heart is, and it's where your background is, Deanna. But this impacts us all in almost every single way, almost every single part of our lives. And because trans persons are largely absent from most of the population-based surveys, that has immediate health outcomes in the daily lives of trans and non-binary persons. So if that didn't sound too mathy to y'all, we hope you stick around. And if you have any questions that come up, please drop them in the chat. This is really engaging. We love it when audience members comment with questions, and then we can answer them here for you right now.
Without seeing any questions popping up in the chat yet, why don't you talk to us, Deanna, a little bit about why having numbers and why having data on trans folks and non-binary folks is important?
I think when we look at population health, right, we're always thinking big numbers, right? And so let me just back up. So this semester, I'm teaching an Introduction to Public Health course at the Melanie Zuckman College of Public Health at the University of Arizona in Tucson, and I have 133 undergraduate students. And our college is one of 60 colleges of public health in North America. And out of those 60 colleges, a very small percentage of them offer anything that even closely resembles some sort of curricula around gender and sexual minorities, right? So let's just go really to the crux of where the disparities are happening, right? And so that prompted, like, well, let's find out what knowledge is in the community. And Ian, you spoke to that. It's like nothing about us without us, right? So one of the things when we look at populations is how do we approach it? And the community knows so much more about themselves than we do. So you have to include the community, and it's really a very important approach. And really, you also have to remember, when you go into a community, you also have to cultivate relationships, right? So generally, what's happened, and I'll just give a little background, with research, there's been a lot of hurt, right? There's been a lot of hurt and harm, right? So you couple that with hurt and harm. So now we have trust issues, right? And we have, oh, we don't have the right way and we don't have the right language, right? So now I have, I'll say the responsibility, right, to educate this cohort of students under the umbrella of this particular topic so that it becomes integrated and it becomes part of the everyday language. So one of it is the integration, right? Because we haven't done that, right? There's no particular way to capture the data. This past fall, I looked at 6 different data sets of data collection demographics. So US Census being one of them, ones we use within higher ed, and then ones we use within particular in our college. And out of these 6 sets, only 2 of them captured really what we would consider an extensive just basic demographics on gender, right? You know, so when we start looking at one, even having the right tools and instruments to measure what we're looking at and having it standardized in the first place is, you know, where is one of the places that we're lacking, right? So I think that I'll just stop right there. Yeah.
So like, that was so much. Thank you. Well, what I think is really important is that you got the crux of the issue, like you said, gender and sexual minorities, and here you are teaching the next generation of public health officials, for lack of professionals. This should be front and center at your attention, and you're fixing the problem you encountered as you were going through your academic career. Like, way to own that problem. But that was probably a really long road to get there. To get to the point where you can make an intro class focused on this. And I believe you said it was a pilot program that you're doing, right?
It is a pilot. So the dean, and it's taken a while, and I'll have to say, I'm developing more and more an appreciation for incremental change, right? I want more disruptive. I want it to freaking flip it on its head like yesterday, right? Right? It's too slow, right? It's too slow because every day our constituents are dying, right? Right? It's so that in and of itself invokes emotion, right? And passion, right? Where I'm at, right? So I'm well educated, right? And that has gotten me places, right? Because the intersections that I have had and what I've experienced over and I'm a boomer, right? So born in 1962, the different systems of oppression and the intersections of being a woman of color, a queer woman of color, and then having to navigate systems. So where I shouldn't be where I'm at, right? So like I'm a statistic on, so we all are statistics on so many levels. I shouldn't even be here. I probably statistically shouldn't even be alive, right? So because I know that, right? I know those struggles. I know when people are having to work a few jobs, right? So now where I'm at, the way that I look at it is I'm a resource to help elevate the voices of the community, right? And I use this is that I'm part of the community and I'm tethered to academia because that's where some resources are. So the way that I see my use, right, in service is that reaching out and hearing the voices of the community, right, hearing what the needs are, and we can only do that if it comes, you know, from the members. Even, you know, when we look at boards that are running large organizations, they're not diverse and they don't have a lens that allows them to truly get to the needs. And really, the way that I think about it is if we can get to the folks who are suffering the greatest health disparities and the worst health outcomes, if we can get to them and elevate them, everybody else flipping elevates in quality of life in every way, shape, or form. Like, it is a no-brainer. And when you think about the data now, so going back to, I'm going to come full circle into why there's so small populations, right? So it's like, well, such a small population. How many trans folks are there? Well, one, we don't know because we're not collecting the data. And well, if we don't know and we don't, it's sort of like, you know, if we don't test, we won't have any cases, right? And so, but when you look at the numbers we do have, and when you look at the health disparities and how it disproportionately affects them, that's the problem. That's the number. It's not the number of people. It's the percentage of the population that is the prevalence of all these things: suicide, homicide, behavioral health, substance, right? So that's the thing. And that's what we have to get. That's what we have to get to, right? Because it doesn't matter if it's sexual and gender minorities. It's all these marginalized groups are experiencing the same kind of health disparities. They just present differently because of the particular nature of that subculture, right? I get so, It's rich.
No, we welcome soapboxes on the show.
I mean, we may sometimes just set up soapboxes for people to jump on. So
I love public health so much, and I care so deeply, right? And I care so deeply why. In 1995, my African American sister died from fucking AIDS, right? 1995, if you look at the data, and you've seen the data, a graph from the peak of AIDS death happened August of 1995. Antiretrovirals came out June of 95. They weren't widely distributed, so she was on AZT, which did squat, right? Peak deaths, the ART started getting widely distributed, and then we saw it go down, right? So it's also very personal. It's also so personal. It's personal for all of us, right? And we have the opportunity. However, we have, it's resilience. Actually, it's it's resilience, right? To be able to use our voices to amplify the voices of others, right? Right.
It's like, I like what you say of like I want to add on its resilience. That's a nicer way of when I usually put it. Like Mars very lovingly told me one day when they were out of spoons, which for those of you who don't know spoon theory, please look it up. But you have so many units of emotional energy to give out during a day. And Mars is like, I'm running low on spoons. And I go, I feel like I'm constantly running low on spoons. And then what was it how did you phrase it again? Mars?
Which one? Because we've had a few of these conversations. Are we talking about?
Yeah, it's and then you told me well, there's forks. It's like spoons, but stabbier. And I go, oh, I think I run on that sometimes. And then Mars went, I think you run on that all the time. And that's like my rage of the injustices that I have faced, that I've seen my siblings face. Like, most people who make effective change in public health have skin in the game, whether it's themselves or their close family or somebody they care about. If you look at all the leaders that ACT UP during the HIV epidemic, which all y'all folks in the comments, if you don't know who ACT UP is, please go research. Like Wikipedia and Google are free if you have access to a computer, but we won't get into that disparity. So it's like and I love what you said about how like you have to look at it proportionally. So I don't think anybody likes being told that that's too little of a problem for us to pay attention to, but you need to contextualize it and make it more human, because I don't think anybody could very easily say to my face is that your community is so small in number, I can't figure out the health problems that are killing you. And I think, Mars, feel free to chime in. Like, there have been times where people try to say that to our faces.
Oh my God. I actually literally kind of got in a fight recently with someone, and I'm like, okay, well, 1 to 1.4 million folks is not a small population. So, and that is probably an underestimate. So this is not as small as you are making it out to be, is what I basically ended up telling the person.
And really, I'm sorry.
No, go.
No, I was just saying, when you think of the connectedness, right? The things that connect us to other groups, right? The similarities. And I don't remember the name of the movie, but in essence, it was over in somewhere in the UK, and it was like the steel workers or the farmers, but they got hit really hard. It was the LGBTQ population that went and just like helped them survive through, economic hardship. And then over whatever period of time, years, the steel workers or whatever industry they were in were able to repay and support that. And it just really made me think of how different they were, but the things, when we have these disparities, they affect us the same, right? It affects our families the same. It affects our children the same. It just it's in a different context, right? And people understand that. And I think that's where the piece of, is the compassion piece, right? The compassion, which is really essential on so many levels.
We have
So-
a
Things
person in
that
the,
I was just looking at the comments here, and
yeah, exactly what I was going to bring up. Perfect.
yeah, but Jessica, thanks for putting in a chat there. But reminding others about the powers of incremental change, and absolutely, and I think context has a lot to do with it. So I started doing this kind of work, essentially gender equity, when I was in my 20s. I was the first woman firefighter in the history of the Tucson Fire Department. So here's this little brown girl in Tucson and being told you can do whatever you want, and in this non-traditional thing. And I was young, I was naive, and I so didn't understand like what the work I was doing in recruiting, trying to get more women and people of color on the job. But it was social justice work, and social justice work is it's incremental change. And I think the thing that speaks to when I know someone is serious, and I feel so honored to say this, is the dean at the College of Public Health is saying things and putting money there, right? And that's when we know, right? Because we know everything revolves around money. It doesn't matter whether you're a 501c3 or you're, Apple or something else, right? It's all about, generating revenues, acquisition of resources, so to see, to have been at the College of Public Health for a decade, and for me, I'm like finally seeing this movement. It's like, okay, incremental change, incremental steps. So thank you so much for addressing that.
I also saw in the comments, it was mentioned, it was the coal miners that the community went and helped. Yeah.
And on that thread of incremental change, like what I've noticed I've done about 10 years work with trans persons, and I have a master's degree in social psychology, which is like kind of like public health. It's more focused on people, but it does reach into population health surveys, and it focuses more on how systems of people work. What I noticed is that we get caught in this weird cycle of there's policy to distribute funding to gather data, but then data influences persons to make policy to give funding. And so trans and non-binary folk, and really gender expansive folk, anybody who's not cisgender, is not being brought to the data set, to the data table, let alone the conversation and policy table. Although shout out to Sarah McBride for winning her senator seat in Delaware this past week. So we have a question in the comments that says, how do we encourage the collection of statistics and demographics that we want to see in places that matter most? I love that question.
Yeah. And so that's wonderful, because now we're looking at, we need both qualitative and we need quantitative, right? And here's the thing and it's beautiful about qualitative, right? Because we all receive information differently, right? So whatever's coming out of academia, there's so many people that aren't going to read the American Journal of Public Health, right? And you present and you have voices through photography, through poetry, through storytelling, through interviews, right? Through however the arts, right? Like that's one way to capture the qualitative, the stories, right? Because when we think about how do we get policy, right? And there's policy, and usually money follows policy, right? And it's all those approaches, right? There may be some legislators that want numbers, right? And some that want stories. And when you have a story, right? And we know this, right? Like, how do we get people to affect them to like being able to even just shift a little bit so that they maybe can begin to understand? But it's really, I think, through all methods of data collection. And I would like to defer to Ian, because Ian and I are working together. We just working to go collaboratively and submitted a grant to do this thing, to find out how do we get more information. So Ian, I'll let you talk about that, because you're really good at talking about those stuff.
Yeah, like long story short, Deanna came to me and we were talking about, I don't even remember where the conversation started, but you brought up focus group, and that's a trigger word for me. Because like for those at home who haven't had access to journals in college, like qualitative data is everything that is not really the hard numbers. So think of images, think of ad campaigns, think of Facebook posts, think of how persons connect on the internet with words, think of text messages. All of that can be bundled in some way into qualitative data. You can get quantitative data from those things, like how many people posted on the site in 24 hours. But the qualitative data is rich, and that when you analyze it as a whole, you're able to extract meaning from it. And so when I hear focus groups, I have a really unique training in research where I want to get to the big data. Like I love your little sample set of 10 people that are trans. Like it's great. I really appreciate you doing that work. Like random study researcher person who got published in sex roles. But I'm done with that. I want to know the bigger picture. I want to know what's happening with more trans persons. I don't want to know about the 12 people you were able to get at this clinic because they have access to transportation and insurance and able to get this healthcare. That is not telling me where I need to put my attention. So I'm like, where do we find the most trans voices? And if you look at what happened with the trans movement would not be here were it not for the internet like this, were it not for social media. And so we have actually been flocking to social media in droves for about a decade right now. We're all over Reddit. We're all over Facebook. We're all over Tumblr. I learned how to transition from posts on Tumblr. So when Deanna's like, let's do a focus group, I'm like, let's not. Because that's just a small sample size. And I'm like, there is a wealth of data that's pretty much active, ongoing focus groups that we should be engaging in, that we should be researching, that we should be understanding. And Z, like, we looked around, I think we shared screen with one group, and I don't know what your face was saying. I'm not too great at reading faces, but you just seem to love the idea, and you're like, let's go all in, because there's a lot of data there. And I think our ultimate goal is to really bring that to provider trainings one day. I think I got all of it.
Yeah.
So for the Mars, are you? Oh, you're there. You're not frozen.
I'm here.
Okay. So like when I look at the question of how do we encourage the collection of statistics and demographics, the first thing you can do is realize that data does not exist in a vacuum. Data is right here. Data is all around you. Data is in your own community, or data are, excuse me. My thesis advisor must hate me right now. So data is a plural word, so it's data are. So data are everywhere. It's on Twitter. Just everywhere you look, you can find data. And one of my dreams is we start harnessing that because we live in a data-rich world, particularly like with our own little mobile devices. I mean, healthcare is already moving into our pocket. How many of you have had a telemedicine appointment in the past few months? Imagine what we can do if we can find a way around HIPAA requirements, and we can actually do a research analysis of clinics that specifically look at trans persons and see what are their health outcomes, what are their disparities, what are they reporting when they come to a doctor appointment. Data are there. We just need people to give us money so that we can build teams to analyze them, because gathering, analyzing, cleaning these data it's not an easy task. The first 2 years of my graduate degree were spent cleaning just 5 data sets.
That's no fun. That's why you write for big grants, you pay people to do that, right? It's like when I was a doctoral student, one of my professors was like, so what do you do for your statistical, what do you do for your statistics? And I'm like, I hire a statistician. I use an SPS data. No, I hire a statistician, right? That's not why I went to school.
I wish I could have done that. Like, Dr. Barger, if you're listening, I'm sorry. I know you love Stata so much. I just suck at it.
Oh man, no. So, but there's so many exciting things about this opportunity. So if we get the grant, we'll find out at the end of this month. It's for the technology to help us to do this thing. And then everything, what's really wonderful working with Ian, which I just really enjoy so much, is that the things that we've been doing just build on one another. So for example, when we started off, we had this thing, we didn't finish it, but we knew everything the time we put in it would move it forward. So really when I think about like, what does this help inform, right? It helps inform curricula for medical schools. It helps inform curricula for colleges of all the health sciences. It helps inform organizations like the American Medical Association, or in Tucson, the Tucson Osteopathic Medical foundation that provides continuing medical education for those of us that are licensed clinicians that have to get continuing medical education annually so we can maintain our license, right? It's for PA schools. Right? There's a wonderful program, and it's been a year now. So Colin Lord, which is a community health center in the Bronx, right? And they received the largest award to date from the Keith Haring. It was $2.5 million to do a 1-year fellowship for nurse practitioners to specifically focus on LGBTQ plus healthcare. And so Colin Lord's one of those CHCs that I've been following. I think they're doing really wonderful things. And I really think that in the Southwest here, we have so many resources, and I really believe we're going to see a significant amount of growth in the next decade. So really, the information the reason we're partnering is to build on so that we can envision 10 years from now, the things that we have been doing, and really what we're looking at and the impact is, are we seeing members of our community thrive, right? Are we seeing the health disparities diminish, right? And it really speaks to the importance of equity and going back to that small population, right? That small population within the United States of America. And when you have a high prevalence, a percentage of those folks that are suffering significantly, right? That is, it's a loss. It's a loss to the individual, the family, the community, but societally, right? Like it has such a significant impact because when you look at diversity, right, and the unique lenses, right, when you have these intersections, like those are the things that you need because everything that we've been doing for so long has been looking from this lens, this lens, this lens. And even when we back up and look at what countries have done well with COVID-19, it's the ones that have had women leaders. And this is why I believe is because they have been treading through the world and life through a different lens, and they take a different approach, right? So when we're losing such diversity, that affects all of us because we are not benefiting from the lens and the suggestions and the solutions that they can contribute to things that afflict us all, right? So it is a great loss on so many levels, such a great loss, right? So that's why I show up, right? Sometimes this work, social justice work is freaking hard, man. People, we want to do it, right? So I'm delighted to contribute whatever I can to ensure all members of our community are thriving.
It's heartening to hear that because oftentimes I think, and Mars, you and I have had conversations like this. It feels sometimes like we're all alone. It feels like we're swimming in an ocean of problems and we're desperately looking for a buoy. It's exhausting sometimes. Did you have anything on that note, Mars, about like, I know that you're not the biggest data person out there in the world, but what I think that you really bring strength and why people love you more than me is that, like, one of the reasons why I adore you is that you're just an incredibly empathetic person. And so, like, whenever I work with Mars, like, and I'm bringing up these data, Mars reminds me a lot of the times, like, of the people behind it. Mars reminds me of, like, especially when I'm down on myself, I've noticed that, like, I've only helped 100 or so trans persons, and Mars is like, that's 100 people, Ian.
It's a lot of people, Ian.
Yeah.
I did kind of have something. First of all, the two of you just blow me out of the water with your responses to this question. Like, oh my God, I love you both so much. Like, that was an answer that took a turn that I didn't even expect, and all the heart. You guys get all the hearts for the way you were thinking about this. But I did find myself kind of thinking about a similar question to what was asked. And it might take us, it might not be the right direction, or it might not be the direction we were expecting to go. But I was thinking about, because I know that a number of other clinics and, you know, people who work at other clinics around both the state and the country kind of watch this sometimes. So I'm wondering, what would be some best practices for people already in the health field to help collect data? Like, do we have sets of best practices for that?
Do you want to jump in, Deanna, or do you want me to?
I'll let you start off because the places that I work as a clinician, we don't have best practices.
So like the most basic thing you can do is just start asking SOGI questions. So sexual orientation and gender identity. Something is better than nothing, and you got to start somewhere. And all good things worth doing are worth doing, at least poorly to start. So don't debate back and forth about how to put it on there or where it goes on the form. Just get it on there. Do it. Once you do that, then start figuring out which questions work for you. At Southwest Center, we found that the 2-factor question recommended by the CDC, which is, I did not mean to make the loser sign, but the 2-factor question, which is your sex assigned at birth, which we broke down into male, female, intersex, even though there are very few persons who are able to keep their assignment of intersex at birth. And then 2, gender. So we look at man, woman, non-binary. I think we put agender down there because we have quite a few agender persons in our community. And then other. What I like to see beyond that is a kind of a space underneath for elaborated explanation if needed. So it's usually pretty helpful for me if somebody says like their sex assigned at birth. We had assigned sex on there once, and one of our clients got really confused because he had had bottom surgery. And he's like, are you talking about when I was born, or are you talking about now? Because I can do the helicopter now. And I'm like, maybe TMI, but congrats. So like, once you get those questions on there, and once you figure out, like, get them on the question, then you need to set up some sort of system to see if it's working with your community. I would love to have like a standardized question across this nation. That's not going to work. It's never going to work until we get it onto a population-based survey like NHANES or the census. I would love it to be on the census. But until then, do something that gets it on there, because researchers on the back end, once we have those data, can use what we call like constructs to create operational definitions from whatever data you have and assign them to different places. It's easiest to figure out, though, from 2 things: of assigned sex at birth, where did you start, and where are you now? And in a recent study of all the clinics in Arizona that did that, like a lot of people come back and say, "Oh, we're upset. You're asking invasive questions." 3% of people were upset, and all the people we're trying to censor, trans persons, queer persons here, were thankful. So that's like the basics.
You know, I think data collection is also tricky, right? Because how growing up, so I'm biracial, so growing up and being asked and having to just pick one, right? You have to pick one, right? Are you black? Or are you white? You know, so depending on, you know, where people fall, there are just triggers just about being asked questions about you to identify yourself, right? I always have to ask myself, why do I need to know that, right? Why am I asking that, right? Andrew Cronin, who's down at in Tucson at El Rio, right? I've heard Dr. Cronin speak so many times, and he works at runs as part of the trans clinic at El Rio for youth. And, you know, he just uses this story about, you know, when a 9-year-old comes in and says they have a sore throat, you don't need to know what's going on below their belly, right? Right? Like, it's a sore throat. It doesn't matter. And I think that throws people off, right? Because I have done this, and I was a student, and he's a cisgender gay man. He's in PA school, and he's in his 2nd year. So I ran the scenario by him, right? And I was working with the Primavera Foundation in Tucson, and they provide housing for folks who identify as female, transitional housing safely. And so So we had someone, Susan, that came in, and Susan said, and this was a while ago, but had some bad words about where they had been seen and never going back. And so came to our mobile clinic and said that they had some sores. They thought it was genital herpes. I'm like, fine. And so Susan, her pronouns, everything like that, disrobes, and she still has male reproductive organs. And so I give this scenario, and I say to my friend Aaron, who's the cis gay man, what would you do? And he froze, right? You take care of the genital herpes, right? You treat the genital, that's it, that's all. And I think the more we start to normalize, right, like these things, it helps us, because there's that moment of like, oh shit, what do I do? And I said, this is not a trick question, right? And I think sometimes just the more that we can normalize these things, it's just like every day, like, oh yeah, of course, really helps. And where do we get that, right? It comes from a lot of places. It comes from home, comes from schools, community, comes from the top down, right? If we can be willing to do something in our workplace, and if we don't get support, that's really challenging for us who want to always do the right thing, or do the right thing to the best of our ability, right? That's hard. So I think there's challenges and incredible opportunities with the fact that it's after the election.
Yes. Like, being part of a 501c3, I cannot endorse any particular candidate, but I encourage you both, like all of you watching, if you are so inclined, just to, like, if you're worried about whether or not data is going to be collected on trans persons, or whether trans persons have a fair shot, go read. Go to the candidates' websites and see if they have policies on trans persons. See if they have policies for data gathering. See if they have policies to put funding toward that. See if they're even mention the word transgender, let alone non-binary. So it's like, those are indicators of different things. And I love that you brought up the election, because like those of us who work in public health, as I fix my lighting, one of the things that often frustrates us, particularly those of us who work with gender expansive persons, like we have the questions, we're doing like basic to better practices in our clinics. We want to expand it further. We want to learn more, and we want to build these programs. But as you said, Deanna, programs cost money. And I love that the dean is putting money where his mouth is, because you can't make things happen in this world without the power of money and funding and resources. And all things money and funding and resources in the nonprofit and public world lead to either billionaires and large endowments, or taxes, taxpayer dollars, and elected officials. So like, if you're sitting here going, I'm not good at math, I'm not here for data analysis, I don't work at a clinic, like, wow, was this relevant to me as a trans person? Like, what can I do? You can vote. Like, you can vote. That is the one duty you have as a citizen, to vote. Just go vote. All right, soapbox over.
And I'm going to be clear on that we're not just talking about a presidential race. Like, the down ticket, the local races, those are extremely important to getting funding for data collection and for programs aimed at gender expansive folks. That is where a lot of stuff starts. And so it's really not just a national thing. It is, look at your local elections too.
Like, Deanna, I don't know if you've ever worked with state data before, but imagine if tomorrow, for those of you who don't know, Arizona's Medicaid is Arizona Healthcare Cost Containment System, ACCESS for short. It's not a confusing name at all, but that aside, it covers hormones, but it does not cover surgery. Imagine if tomorrow ACCESS changed their protocol so that when somebody was enrolling in ACCESS, we figured out whether or not somebody was trans. They had that 2-factor question, and we gave them appropriate referrals to trans clinics once they got on insurance to get on hormones and then surgery. Like, what if our state Medicaid had access to, like, by law, which local representatives put in place, what if we elected officials that changed the discriminatory policy that let ACCESS cover insurance? As far as I know, a lot of ACCESS data is kept by the state. What do you think that would mean for public health if positive policy came down, what would you as like a public health researcher be able to do with that?
That's, I mean, that's a one. I want to start with, I don't even know where to start. Right?
It's a dream.
Right. Yeah. There's a lot of mixed feelings, right? Because the data that the state has is the people that they have access to, right? So when we start looking at state data, then we break it down into the counties, where the county's located, who's the most represented. And I think that there's already a bias in there, right? In there, just when you look at the populous areas, right? Maricopa County, right? And so like, and then we start actually going over into like the politics, because that also dictates where the money goes, right? You know, when you start looking at if in the center, right, and you can see this all over the place, right? It's heavily concentrated here where a lot of money. So when we're looking at like taxes, right, money that's coming in from the feds into the state, really. And I really think what the data might help us do, given the right people are using it and being able to use it in a way, it will actually better help us distribute the resources in an equitable manner to decrease the health disparities. But I really think that that requires the right people in place to have access to the data, right? Because you can have, but who's analyzing it? What are they looking for, right? So I think that's what data is not being, right, transparency, that's the word. I'm like, transparency is always an issue, right? You know, so those things I think are always going to be wondering unless you go right into the communities, right? Like that's the thing. We can identify the pockets, right? But I really think it'll always go back to, again, equity and the equitable distribution, you know, of those resources throughout the state. And I think that's really the best way that I can articulate like what having access to that data will do. I think I go back to like, why are we collecting the data, right? Okay, so we report it. Okay, so we report it. What are we going to do when we report it? Someone, you know, whatever it is in terms of morbidity and mortality, right? So I think that information is really important when we start looking at morbidity and mortality, because that'll tell you, okay, and then you find out what those are, and then that's where you need to focus those things. But going back to the original part of this is, if we don't have data on those places, it doesn't really matter. So it's the data that we have, and it's like, how do you get those people in charge, right, to give them the resources to really go in to the communities to fill in the gaps of where the data is, where the data are, right? You know, because we know all the data we have isn't complete, right? So it's sort of like a catch-22 in some way.
I love your answer on multiple levels, but Mars, do you have thoughts first before I ramble again?
I'm going to let you ramble for a little bit because I have some thoughts that'll be a slightly different direction. So,
can I just say one thing? Is one of the things that I really appreciate is that our responses all truly represent diverse lenses of it, right? Like that's the thing, right? And that's the importance of like diversity, right? Is we can expect to like, oh, this person's going to say this thing, right? And it really speaks to like why diversity is so important. So thanks for letting me chime in there.
I love that you're here and the responses you give, and you touch on all the things I was hoping you would. Like data is there to inform and direct and to help us realize where persons might need help. And I'm not going to be this white guy who goes in there and saves the day, because that's not going to save the day. We're not going to understand how to make things better. People who are living through that life are going to understand how things are better. And Mars, I don't know if this was passed down to you, but when we were starting up the condoms program at Southwest Center, we actually got a shipment of condoms returned, which never happens. It's a shock. And it got returned because it was on the reservation, and the address didn't exist for UPS. It only existed for USPS, which tells you why USPS is important. It reaches some of the more rural areas. So this is a public health tool for contraception and STI prevention, that we are trying to get to the most vulnerable people through drop shipment of UPS. And because we're here in Phoenix going, oh, this will work. And not one of us called the shipping company or the person at the hospital where the condoms were to go to see if they needed what they needed. So we failed. And then, so I fixed the shipment. We got it through like some sort of USPS partnership. Largely it happened through David at Global Protection. Shout out to you for making that happen. But when we delivered the condoms, they said, we can't use these. They're condoms. Why? Like, I didn't understand. And I was frustrated. And the response was, well, men here in this area don't wear condoms. We need internal ones. Why? Here I am trying to fix the problem, going head over heels, and the first thing I should have done was just have a conversation with the person the comments are going to. Like, we have the data. We know HIV is high out there. We know unwanted pregnancy is high out there. We know we need to get contraceptives and barriers out there. We know we need to get them to these specific places. So I had all of that from state data, and I still screwed it up. And we've like, it's why you can't be a good public health official and why you can't engage with gender expansive and gender diverse communities unless with just data alone. You really have to gauge with their narratives to figure out what works. So you brought up exactly what I was hoping you were going to.
And I think that actually kind of ties into my next question. I feel like my role tonight is just to ask y'all questions and learn and soak everything in. But that is, as trans folks, what can we do to help encourage data collection from the places we frequent or from health officials beyond voting? Like, what else how can we also be active in this process?
Whew, that's another loaded question, Mars, right? And it's loaded for a few reasons, right? So here you are asking, what can we do to help? And then we always know that the burden falls on the population that wants to be helped, right? That we want to help where the disparities are. And so you're putting an additional burden, right? So this is like, how do you approach it in a way that has a mindfulness, that respects and understands all the layers of access, barriers, challenges, you name it, and then asking, oh, can you help us some more? Right? You know, here's the thing is, I have and filled with so much gratitude, so many privileges. I sit on a couple boards on Tucson, and one's a new board. And I get frustrated all the time. I get triggered, like it sucks sometimes. I'm like, you're flipping kidding me, right? Again, right? Having to talk about what, like, compositional diversity doesn't really mean you understand. Just because you have a board that's diverse doesn't mean you understand diversity, and they do not. So a couple of weeks ago, I'm just like, here we are, and the three of us, and I can call this, I might call it out on myself, right? I have the privilege to sit here and rest at Maslow's top, create, problem solve, the top of the Maslow's hierarchy. And I have an hour, like I'm doing this, right? And every single day I go back to our constituents are dying, right? You know, so when I go to the community and I'm asking that, I've got to understand that every single day my constituents, the community members, are on the bottom level of Maslow's. So if I have an ask, right, I have to think of, like, what are their needs, right? If those basic needs are taken care of, right, and we're not addressing those, right, those social determinants of health, it's a catchphrase, but it's so true, where people work, live, are born, learn, go, like all those things, right? If we aren't addressing those things, right, I can't even put an ask out there. And when I do, I better be willing to look at what compensation, what's the value, right? What is the value that individual, that community is offering that's going to benefit all of us? And if we're not willing to do that, then it's sort of like, you should kick me to the curb if I'm not showing up and saying, like, how can I help you first, right? Because this is a win-win. We have to come in with win-win mindsets, because if we don't, like, I don't want to work with you that way, right? That's not okay. And so I think it's the way that we do the work. When I say we, in academia, right? And we being part of the community, is also being very mindful of sort of like safeguarding the community, right? Because we have historical trauma that's been caused from research. I have to also be mindful of that. And so Mars, it's hard, right? I believe in cultivating relationships, and 10 years at the College of Public Health, 8 of them in my doctoral program, the take home was, you cultivate relationships, right? You cultivate relationships, right? And that's where we're really going to get a return on our investment on our time. We cultivate authentic relationships, right? Because we have to build that trust, right? That you'll trust that I'm going to do what I say I'm going to do, that we're going to have communication in which we both understand, we share the same language, we are both looking for the same things, we respect, value one another, and we come to the table with a high level of integrity and build the best that we can every day, right, on both sides. And I think with an honorably, right? Yeah.
I think that's one, Mars. Good question.
I'm
And
like,
two,
that was more beautiful than I could have handled. Oh my God. All of the heart.
And like, I think you gave voice to a lot of the frustration I often feel. It's like, I never feel like I'm doing well enough. And I think Deanna, you and I have discussed this. Like, we come from this place of privilege, yet we're part of this community. So the burden is there. And so it never feels like we're doing enough. And then, like, there's trans persons who are struggling more than us, and they're still doing something. And I've talked to them. They're my clients a lot of time, and they feel like they're not doing enough because the world is demanding so much of us just to exist. So if you're trans out there and you are watching this and you're wondering how you can contribute, look at what you have, and recognize that every day that your breath is an act of resistance. You being here is doing something. And we are doing whatever we can to make this world better with you. There was in Utah, when they were passing their equality legislation, the mayor there, I believe, was tempted to not do it because they could get it passed for gay and lesbian and bisexual persons, but they didn't want trans persons on the bill. And it looks like it wasn't going to pass through legislation. And so the mayor said, full stop, we're not crossing this finish line unless we do it together. And they got it passed. So, like, thank you for giving so much context and heart to that. You made me feel so validated. And I think you resonate with a lot of audience members, even though we can't see you. We're close to end of time. So I want to spend this last minute thanking Deanna for joining us with such passion, such intelligence, such wealth of research and background. For Mars for sticking in there. And honestly, I think you synthesized a lot of our conversations in a way that kept this flowing. So thank you both so much for being here tonight.
Thank you, Mars.
Thank you, Deanna. Like, this was fantastic. I really do want to take that last answer you gave and just cut that and send it to a whole bunch of people. You have no idea how many people I'm like, okay, I need you to hear this, and I need you to hear this, and I need you to hear this. Because, yeah. And thank you for all of your answers. Just
thank you. Thank you for giving me a voice. Thank you for amplifying my voice. Our voice.
We do what we can. Ask a Navigator is a special show, and Mars put it best. How did you phrase it, Mars? Trans people
creating trans content.
Yeah, trans people creating trans content, amplifying trans voices and non-binary voices, all gender expansive voices. And a little clue for the future. Maybe this won't be Ask a Navigator anymore. Maybe it'll be something different. Stay tuned in the next months. All right. we're at the end of our time. Thank you for tuning in. Next month, we'll have Ask a Navigator on December 7th. Thank you so much to Mars and Deanna. Thank you to Jericho behind the scenes. And I usually try to pick somebody different to thank at the end of every month. And I think Deanna inspired this one. Thank you to all the trans and non-binary and basically all the persons who aren't cisgender in this world for existing. It's been a really tough year. T-Door celebrations are coming up. Trans Day of Remembrance is a hard, for lack of a better word, holiday for all of us. But if you are here and you are breathing and you made it, I am proud of you. I'm thankful you're part of my community. And I hope to see you next time on Ask a Navigator. Bye.